Welcome to this presentation from the Council of Medical Specialty Societies. We're here today to talk about long COVID, education, engagement, and management for neurologic symptoms. There's a whole group of expert panelists who are going to be talking to you about various aspects of long COVID. I myself am Bill Niehaus. I'm from the University of Colorado. I'm a physical medicine and rehabilitation doctor in our multidisciplinary long COVID clinic. I'm going to be talking to you about more specifics about long COVID. And I want to first start with how prevalent is it? It's 3 to 6% of the population. So when you think about the US, that's around the same number of people with Alzheimer's for closer to that 3%, or people dealing with cancer if you're closer to that 6%. And really, if you think about that, you know people who have loved ones dealing with Alzheimer's. You know people or yourself have dealt with cancer or have been impacted by that diagnosis. And so inevitably, you are already seeing long COVID patients. You might not realize it, and the patients might not realize that long COVID is the thing that's impacting their lives. And so, really trying to think about who is that person over the last day or so, or the last week, who has been dealing with these symptoms that might be long COVID, really trying to raise the awareness of how much long COVID is out there. For neuro things in long COVID, we're going to be talking about neurocognitive dysfunction, headaches, dysautonomia, and sleep disorders, and how to manage those in the 3+ months that these symptoms can be there. So when we think about brain fog or neurocognitive fatigue, it's characterized by poor concentration, forgetfulness, slow processing, and it's typically worse the more it's worked, the more it's added to with exertion or physical function during those cognitive tasks. Cognitive support strategies and cognitive behavior therapy and a structured return to activity can all help folks, but you can also utilize those allied health professionals in neuropsychology and speech therapy to help set up that system for a patient who's working through those brain fog issues. The other thing that goes along with cognitive fatigue is headaches. And this is different than most tension type headaches or rebound medication overuse type headaches. It's typically associated with post exertion migraine like symptoms. And neuropathic pain medicines are really great for this. The amitriptylines, the gabapentins, and optimizing comorbid sleep issues, which we'll talk about later, all can help headache long COVID patients. You also want to try to avoid those triggers and pace things to really make sure you're optimizing those next steps for people. Cognitive fatigue and brain fog are things most providers are pretty comfortable managing, at least taking the first pass at. But once we move into dysautonomia, that's sometimes where it feels a whole lot less comfortable starting to manage that. So when we think about what is dysautonomia and postural orthostatic tachycardia syndrome for patients dealing with long COVID, what does that actually look like? So when we're thinking about POTS, that's typically an increase of a heart rate by around 30 beats per minute on standing without associated orthostatic hypotension. So when we think about that, the best way to really evaluate that is a 10-minute sit to stand test to really support that diagnosis if you need that as a part of your next step. And that's really just kind of having someone transition those different positions and stay in the standing position while you're watching their heart rate. And so great. Now you have someone that has POTS. What do you do with that? And what are the things they're talking to you about? They typically describe having palpitations, dizziness, fatigue, heat intolerance, and just feeling like there's an extra layer of that fatigue and a resting heart rate that just seems faster than it otherwise should be. So the typical way we approach that, especially in the neuro rehab realm, is we focus on optimizing hydration. We talk about optimizing electrolytes and making sure salt intake is appropriate. We utilize compression garments and other things to help support that system to realize that the body is actually moving things around from a fluid dynamic standpoint better than it thought it was. And starting to build that graded return to activity. So if you have someone that's really only able to walk about 10 minutes more per day than they were previously, you start adding 10% to that every 10 days. So you have that person go from 10 minutes to 11 minutes, and you slowly build that activity back in a way that hopefully avoids some of those fatigue crashes. You can also sometimes utilize beta blockers like propranolol or other ones to help pull back some of that sympathetic running hotter than it should be situation. The other thing we can really capitalize on is helping people build that energy battery back better. And so, one of the best ways to do that is optimizing sleep. Most long COVID patients talk about having insomnia or being too sleepy or having fragmented sleep when they're actually able to get it. And that all compounds the issues we're facing with cognitive function and fatigue. So, if you're able to use those techniques we know help sleep, cognitive behavior therapy, first line, rule out any sleep apnea or other restless leg situations that can really impact that sleep pattern and that sleep behavior, and optimizing sleep hygiene, cold, dark room. Not using screens right before bed, using some of those blue light filters or red light phone setups so that it's less likely they're getting hit with a whole bunch of blue light before they're trying to fall asleep. All those things help people optimize sleep, recharge their batteries, and help fight that fatigue picture that's always plaguing that long COVID patient. The other things they can present with that sometimes are difficult to really tamp down are kind of the generalized body aches, paresthesias, numbness, and non-specific findings that can go along with the neurologic impacts of long COVID. You're talking about tremors, paresthesias, sensory hypersensitivities. All can impact that long COVID patient, or if those were there before and they develop long COVID, they can all get worse. So you're really thinking about those same things like you would if someone came in with maybe carpal tunnel. You're thinking about getting nerve conduction studies, maybe an MRI if you really feel like there's a focal abnormality you want to rule out, and sometimes referring to those neurology or neuro rehab providers to help rule out some of those red flags. And that's that next step is really thinking about where are those multidisciplinary things that can really be helpful for you. Is those neuro symptoms things you need to add neurology, PM&R, psychiatry, psychology, sleep medicine to help round out your interventions to help that patient recover, build a better recovery system, get sleep better, and build that activity back. Patient education resources are out there utilizing the other talks associated with CMSS. Ensure documentation and accommodations to work are being instituted in your notes or documented separately to help that patient have that ramp back to a prior level of function as easy as possible. There's a whole constellation of other symptoms that are going to be part of some of the other talks we're going to do, but overlap with those neuro symptoms. We have palpitations, cardiac issues, cognitive, low mood, depression, fatigue, malaise, general body aches, and then also you can have mast cell activation, rashes, and hives, and other things that go along with that. And so bringing that all together for that long COVID patient is going to be hugely beneficial and help them and you through this process. The really big key takeaways here are long COVID patients are out there and you're probably already seeing them. So when they show up with that generalized fatigue, body aches, brain fog, difficulty sleeping, you're going to have a little bit more awareness that that's occurring more than you might have thought. And you have ideally some ways to help manage those common neurologic things like brain fog, headaches, dysautonomia that require that targeted intervention or referral out approach. Pacing and education are always important and essential, and referring to those specialty care providers when that comprehensive support is really needed. There's a whole bunch of additional resources out there through CMSS and other organizations. If you're watching this video, there is a QR code that you can use. Otherwise, going onto that CMSS website will help link you to those other resources and things we can help you out with. Thanks so much for joining us today. It's been a pleasure. And again, thank you for listening and helping care for those long COVID patients out there.